thank you. Thank you so much for getting us started and kicking off our session today. I want to kind of reiterate what was said in the beginning. I think we're not a huge group, and I would love to have people actively participate. You can use the chat. I'll be monitoring that. If you have any comments or questions, we can share out your ideas. As we get going, you might have some resources that you've used that are related to this topic, and I would love to share those as well. Okay, so our session today, which is pretty short, just 45 minutes, is called Salud, using ACES to teach health literacy. So I am Stephanie Sommers, and I am the ACES coordinator through Atlas. I have worked on the project since it started and we were first developing the TIF. I am also a coach for something called TSTM, which is a national project that is being sponsored by OCTAE and hosted through Links. It stands for Teaching Skills That Matter. And I will talk a little bit more about that as we go on, because they have some great lessons to help support teaching health literacy. But in addition to my consultant work, I also work for Minneapolis Public Schools, and I'm the adult education coordinator there and also the writing curriculum team lead. And in our session today, we just have a couple of objectives. So one is to make sure we all understand what's included or what is meant when we talk about health literacy. We also want to explain how using ACES TIF can help to build more knowledge and skills in this area. And if you are new to ABE, first I want to say welcome. And then I also just want to say we will go over what ACES TIF means in just a minute. So certainly don't feel bad if you're sitting there going, I don't know what that means. And then we are going to locate some ready to use resources. Always, I like to share resources that are free and that you can use in your classroom. So these are the things we'll be focusing on. Okay, so I thought we'd start a little bit with why is health literacy important? So obviously we are all living through a pandemic that has been much bigger in scope than I think any of us thought it would be, and really unlike anything any of us have probably lived through before. And when I think about health literacy, I think about all of the health-related information we have all had coming at us over the past 18 months or so. So I pulled some screenshots off of the World Health Organization website. So does sunlight kill the new coronavirus? Remember when we might have heard that? Can eating garlic help prevent infection with the new coronavirus? And then does vitamin D cure COVID-19, right? So there are few areas of our lives that I think are as important for us to be informed about as our health and the health of our family and loved ones. And there are also not a lot of other areas where there is just so much information available, right? There's information available from the World Health Organization, from the Minnesota Department of Health, from websites like WebMD, right? But we also know there's a lot of information that's shared that might or might not be factual. I remember when I got my COVID vaccine, I was talking about it with some of my students in our virtual writing class last spring. And one of my students said, "You really got the vaccine?" And I said, yes. And a lot of them were asking me, well, how did you feel? Which one did you get? And he said, some guy at work told me I shouldn't get it. And, immediately I chatted out, I shared with them a link to the Minnesota Department of Health website. I showed them where they could go on there and get some information. And I just, we talked about who should we be trusting with health information? Should we be trusting, that guy from work? Or should we be trusting people who are experts in that area? And so I think teaching our students to have a background in health literacy is really essential. And it includes helping them know some of the vocabulary, understanding how to evaluate the information that's available, and also, working with their ACES TIF skills to be advocates for their own health and to know how to ask questions. So I mentioned the teaching skills that matter, and we're going to get to more of that. We're going to really dig into that in just a minute. But this definition of health literacy comes from the toolkit from their health literacy issue brief. Health literacy skills means having the knowledge, skills, and ability to ask relevant questions, to obtain and apply information for credibility and quality, communicate effectively, and make critical decisions to promote one's health and well-being and that of one's family and community. So when we talk about health literacy, it does go beyond just maybe having our students practice certain vocabulary, like understanding words for illnesses, being able to talk about a symptom, understanding certain remedies. It does include those things, but it includes more than that. When we think about really robust health literacy, it involves understanding things like how to choose a health plan, being able to compare insurances and knowing some of the basics about what's involved there. It involves something that I just did. My school district, we're at the end of our open enrollment period for benefits. So I just logged on a few minutes ago and made my selections for the coming year. So I'd have money in my health savings account. And all of those things go into understanding health literacy. If you have anything you'd like to share about maybe areas where you feel like your students have had questions around their health, or any comments on the definition here, I'd love for you to put that in the chat. All right, so I promised I would talk about the TIF here. And so I kind of am making a play on the name of this conference, but so the Transitions Integration Framework, or TIF, is one of 3 sets of Minnesota ABE content standards. It was developed originally back in 2013, which feels like so long ago now. And it was developed with a working group that included teachers, ABE teachers from many different programs, also representatives from higher education and representatives from DEED and the workforce centers. And so looking at many different frameworks for employability skills, we sort of combed through that research and came up with our own 6 categories of essential skills for adult learners. What makes the TIF a little different from some other soft skill frameworks, because there are many, is that the TIF includes sample activities for practicing the skills at 3 different instructional levels and in 3 different meaningful contexts. So when the TIF was developed, we wanted it to be something that could be used from the beginning of instruction with learners, because we know we can't be waiting until our students advanced to intermediate or get up to advanced ELL to be able to start practicing these skills. And so the TIF contains activities at a beginning, intermediate, and advanced level, and also within the context of work, community, and school. And thanks to Amber for chatting out the link here. That's where you can download a copy of the TIF and also see more information about this initiative. So there are 6 categories in the TIF: effective communication, learning strategies, critical thinking, self-management, developing a future pathway, and navigating systems. The TIF, again, is the product that was developed out of this initiative. The project itself is called ACES, which stands for Academic, Career, and Employability Skills. And along with the CCRS and North Star Digital Literacy, it makes up one of the 3 sets of Minnesota ABE content standards. Here is a page from the TIF that I'm just showing in case anyone, again, is new. So inside the complete TIF, there's also a version called TIF at a Glance, which does not contain the activities. But inside the complete TIF, You'll see a definition for the category, and then each category has between 3 and 4 skills. And then each skill can have a number of sub-skills. So this is from the effective communication category here. This is skill 1, engage positively and actively with individuals in both one-on-one and team settings to accomplish goals. And then you can see all those different sub-skills there. And then for the suggested activities or sample activities, they are focusing on sub-skill A. And then there are some examples of ways to use role play scenarios to practice this skill. And you could practice it within different contexts, such as at the grocery store or at the bank, or asking questions in a classroom, or trying to clarify an error that had to do with one's paycheck, maybe. And so the TIF was really designed to not only outline the skill areas, but also to provide real examples of how we could use the skills in our classes and to help teachers get started with using it to make it a little bit easier to implement. Okay. And then the other sort of big initiative that I will talk about for a minute is TSTM. And I am sorry if you're new. I know there are 100 different acronyms. There's all kinds of alphabet soup when you start in ABE, you know, beginning with ABE and what that means. TSTM stands for Teaching Skills That Matter. And it is a project, like I said, that was developed to sort of support WIOA, the Workforce Innovation and Opportunity Act. Many of you might know WIOA is sort of the source for a lot of our ABE funding at the federal level. And so TSTM was developed as a way to help adults who are developing their skills to help to provide really the best ABE instruction. And so TSTM is primarily a toolkit, and the toolkit is divided into 5 topic areas. There's civics education, digital literacy, financial literacy, health literacy, and workforce preparation. So those are the 5 areas. And then it also highlights 3 instructional approaches that are known to be very successful. There's project-based learning, problem-based learning, and integrated and contextualized instruction. And so those 3 approaches are particularly useful because they allow many different skills to be sort of combined and taught at the same time. Often when we work on projects with our learners, for example, we are combining, you know, maybe reading, speaking, maybe there's some digital literacy, there's teamwork, there's effective communication. So it's oftentimes a much more participatory and robust approach to your instruction. So we have those 3 approaches, and then finally we have the 9 central skills. These are the skills that matter, and you can see them here on the screen. Adaptability and willingness to learn, communication, critical thinking, interpersonal skills, navigating systems, problem solving, processing and analyzing information, respecting differences and diversity, and self-awareness. So this is sort of an overview of how the toolkit has been designed. As I said, the project, all of the resources can be found on the links website under federal initiatives. In addition to the toolkit lessons, there's also a video series where you can see teachers teaching some of these lessons. One of the videos features our own Leah Conklin Olson and her students over in St. Paul. But what I wanted to really highlight today were the health literacy lessons. And so if you're a little new to ABE or new to thinking about incorporating something like health literacy, this is a great place to start because the project contains For each of those areas, so for each of these 5 areas, there are also 5 lessons, and the lessons are downloadable and just ready to go. And so each tab, each section contains 1 integrated and contextualized lesson plan, 1 project-based, 1 problem-based, and then a couple of others that you can look at. They are at different levels. There's different levels throughout the toolkit. And these would be a great way to get started. These lessons were developed by nationally recognized experts, subject matter experts in each of those areas. And then they were tested through a pilot process where teachers tried them out in their classroom and gave feedback, and then there were some revisions made. And so now the project is in its 3rd year, and these lessons are really solid and a really great way to start if you're looking to get some new materials. So now we'll look at what some of these lessons, the health lessons, look like. So this is one that was designed to support problem-based learning. This is more of an ELL focused lesson. In this lesson, students read about the Diaz family and some of the challenges that they've faced navigating the US healthcare system. A lot of their problems have to do with about being able to communicate with their doctor. And so when students dig into this lesson, they work in groups to identify some of the issues and possible solutions to help the Diaz family achieve a better health outcome, okay? And then I wanted to highlight another lesson. This one's at an HSE level. This lesson was designed to help students think about the cost of smoking. And this is an integrated and contextualized lesson, so it does involve a lot of math. It involves some word problems, looking at graphs. It's got visual literacy. It has students thinking about how much they spend or one might spend on something like cigarettes, a habit like cigarettes, and thinking about what they could maybe do with that money if they were to give up that unhealthy habit. So this is another really good lesson from the toolkit. I wanted to show these because they're 2 different approaches. They're also for 2 different target audiences. And again, they are just out there for you to grab and use. And if you were going to try using the toolkit lessons, how could they maybe be useful for you? Well, you could try one of these lessons, and it would be a great way to dip your toe in the water with getting started with health literacy. The lessons can be adapted and modified. They are considered open source, and so you could use just pieces of them. You could use them as inspiration, but you can make them yours. We know that many teachers want to plan units of instruction and not just do one-off lessons. So if you would like to maybe plan a unit around health literacy, you could maybe use one of these lessons as sort of like your culminating task. And what I'm going to talk about for the rest of this session then are some activities related to health literacy that could work with the variety of instructional levels and be used to scaffold up to the toolkit lesson or as extension activities, okay? So we've just seen where we could get lots of information about health literacy and even some lessons. And now we're going to talk about, well, how could we maybe build on that and bring in more ACES TIF skills to really embed some health literacy learning in our classes? And finally, it's worth remembering that these activities and learning tasks can be used to develop ACES TIF skills in a variety of contexts. So today we're talking about health literacy because it's an important topic for our time, but you could use a lot of these activities to teach in different context areas, okay? So an important area from ACES TIF is critical thinking. That's one of our categories. And one of the skills one of the sub-skills, I guess, under critical thinking is categorizing and synthesizing information. And so I was thinking about what are some ways that we could help our learners to categorize health information. So for example, they could sort or determine what is healthy versus unhealthy. And that might be a food or a habit or an activity. They could maybe sort or categorize symptoms versus remedies, or match a symptom to an illness. They could determine if information is true or false, or if it's fact or opinion. For a little bit higher level students, maybe talking about if a health situation is an emergency or non-emergency, if you're talking about a prescription medication or over the counter. And then for maybe the more advanced students, talking about if a certain condition might be caused by genetic factors or if it's influenced by lifestyle choice. And so categorizing, again, really great for developing critical thinking skills. And here are some easy tools that you can use with your students to develop this skill. So a T-chart is one of my very favorite types of graphic organizers. I love T-charts because it doesn't get much more low prep than having your students draw a line down the middle of a piece of paper, right? And then just label the top of both sides. And you could use any of these headings here and then have your students sort by some of these criteria, right? Additionally, another type of really great graphic organizer for developing critical thinking skills is a Venn diagram for helping our students compare and contrast or take information from a text or from a chart or a graph and compare it using a Venn diagram. So these are some ways to practice categorizing and synthesizing. I also was thinking about how you could maybe use medicine labels or food labels to do some of this work. So I found this particular activity from e-reading worksheets. It's part of their nonfiction reading activities collection. And thanks to Amber for chatting this out. So this particular worksheet, which is Amber chatted out the link. I also put a PDF copy in the participant folder. This is comparing aspirin to acetaminophen. And I was thinking, there's all kinds of interesting stuff you could do with this just by giving it to your students and saying, which of these contains a higher level dose of the active ingredient, right? The aspirin's 325, the acetaminophen 500 milligrams. Which of these, compare and contrast maybe what it's used for. Compare and contrast the warnings, for example. I was thinking there were all kinds of things you could do if a person has X condition, for example, which type of medicine should he or she use? And so I think there's a lot of things you could do just orally with this, but then there are some questions that go along with it that you can download right from the website to practice with your students. Which medicine comes in gel caps, which may cause stomach bleeding. So doing some close reading here would be another great use for these materials. And then there's another one that comes from this same collection of nonfiction activities. And this is comparing two food labels. So we've got vegetable chips and rice cakes, right? And so looking at the information, you could have students maybe work in teams to make some statements or ask some questions, right? Like, which food has more sodium? Which food has more sugar? Which food has less fat, right? And then I thought a little more rigorous for critical thinking, which food would be better for someone on a low calorie diet or a low fat diet or a low sodium diet? Asking those kinds of questions and then having students actually explain why they they give a particular answer. And again, there are questions that go along with it, but I think you could do this using these worksheets. You could even do it by just bringing in some items from your pantry and having students talk about the information on the nutrition labels. So now I'd like to ask, what about you? What are there activities that you like to do with your learners to practice critical thinking skills? If you have some activities that you do to practice critical thinking, could you adapt any of those activities for a health literacy context? And I would love to get at least one comment in the chat. So if you would, everybody has great ideas to share. So, even if it's something you think everyone already knows about, I promise you there's someone who will not know about it. So it would be wonderful to get one or two people sharing ideas in the chat about activities they use to develop critical thinking skills. And then I'm going to keep going here and move on to the next TIF category, which is effective communication. But just because I'm moving on doesn't mean you can't put something in the chat, okay? So under effective communication, there are a number of things that we can do. One of the skills that is important to practice is seeking and offering clarification, right? So what are some ways that we can help our learners to clarify questions and answers within a health literacy context? Well, we can practice with sentence frames or stems. We could do role plays and scenario-based learning. We can practice paraphrasing techniques. So paraphrasing is a great way to help for your students to demonstrate that they understand something. And there are specific techniques that we can teach, such as using synonyms. For written paraphrases, it's also things like changing the sentence structure, right? Maybe making an active sentence passive, for example. So those are things we can work on with our students. There's information gap activities, and then partner interviews or one-question surveys. So these are all ways to practice seeking and offering clarification and practice our effective communication skills. And thank you, Karen, for helping me not to feel like a lonely lady here. Karen put, similar to what you already shared, I work with students to triage where to go for care, clinic, emergency room, etc. Yes, that's great. So how do I know, because the truth is our healthcare system might be very different from the one where students came from, right? Here in the US, we have lots of options, right? We have just going to Walgreens and picking up some over-the-counter medicines to, doing a telehealth visit to going to a minute clinic, all the way up to, the urgency room, the regular doctor's appointment, or an emergency room. And so I think helping our students to understand when each of those is most appropriate is a great way to bring in some health literacy. So thanks, Karen. I would love to hear, okay. And Keith says, guiding questions and discussing a reading. Yeah. And so we can help to draw our students' attention to whatever we think is most important or relevant in a text, right? So simply by creating some questions that kind of bring us to the health-related topics or issues, we can help to develop health literacy, right? Thanks, Keith. That's great. All right, so sentence frames are a great way to help our students develop the skill of asking for clarification. The reason frames are so nice is because it provides students with the academic language supports that they need to feel successful, while sort of freeing up space for them to think about their message, right? And so instead of having to think about, well, what do I want to say and how do I say it? Using a frame means I only have to think about what I want to say, not the best way to say it, right? And so here are some different frames that come from this website here, Spartanburg 7. So, you know, using someone's name, for example, Amber, could you please rephrase that? I did not understand blank. Could you repeat that, please? I did not understand blank. Do you mean? Okay. It's not quite clear. Can you explain what you said about? Can you say more about that? In other words, are you saying, that's where the paraphrasing comes in, or I have a question about, right? And helping our students to be able to phrase questions that really get at what it is they're trying to ask is something we can do to support our students in our classrooms, right? Making sure that our students know how to ask a question clearly and how to follow up when the answer they get maybe doesn't actually match with what they were trying to ask or the information that they were trying to get at, right? And then there are also these great collaborative conversation cards that you could use. So these come from a resource out of Illinois, the Illinois Literacy Action Group, Literacy in Action, sorry. And there's actually cards like this for all different types of tasks included in this PDF. So I just am focusing on the ones for clarifying, but there are some others for like making polite requests or, you know, disagreeing, all of that. And you could use these in class, have your students use them in small groups, for example, have them use them with partners, maybe provide some scenarios. And I think Amber says she loves these for her math class too. Yeah. And so I think this is great. You could have some of these just, you know, ready to go. And it's a great way to help our students. We're giving our students the language they need to explain when something is unclear and to ask questions so that they are able to better understand what's going on, right? Which is one of our big goals as ABE teachers. And so here are some different ideas for using these stems or frames to practice some health literacy. You could do an info gap or info exchange using a sample medical or patient information form. For those of you who might be familiar with the Ventures text series, I know that this kind of info gap, like with a medical form, is something that is used in that book in some of their, what are those called? Collaborative activities. Role play describing symptoms to a care provider. Role play asking questions to a pharmacist, maybe about a new medication. Role play discussing sick leave policy with an employer. Role play calling an insurance provider to ask about if an office visit or medical procedure is covered. I know at my work, we changed healthcare insurance companies a year ago, and I have made many phone calls trying to ask if this or that is going to be covered since the change. And so this is something our students need to be able to do too. And it's something we can help them practice in class to make them feel more confident. And my old colleague Rachel says, great resource, can be used for many levels too. Thanks, Rachel. It's good to know you're here. Okay, so what about you? What activities do you like to use to develop effective communication skills with learners? Is there anything that you could share, a favorite resource maybe for helping your students practice effective communication? And then is there any way you could adapt that, one of your favorite activities, for a health literacy context? It'd be great to get some of your ideas about effective communication. And I'll keep looking at the chat, hoping to see some more comments. And we'll move on to our third and final skill which is navigating systems. So in navigating systems, which is one of the categories, I would say probably the only category from the TIF where the name doesn't, really fully explain what it means. So navigating systems is not literally about, the navigating piece sometimes throws people, I think. So we're not talking about figuring out directions exactly. Navigating systems means understanding how to get through one of the more complicated processes where you have to maybe navigate many steps, talk to different people in order to reach an end result, right? So when we think about something like applying for financial aid for college, applying for public benefits like rental assistance, or last year during the pandemic when so many people needed to access unemployment benefits, all of those are things that are related to navigating systems, okay? And then for any of you who might not be aware of the categories in the TIF we've talked about today, navigating systems is one that also shows up in the adult diploma. So students have to show evidence of navigating systems in their adult diploma portfolio. And so if you talk about this in class and you name it as navigating systems, it can help students to come up with ideas for what to include in their portfolio for you who might be working in a diploma program. One of the easy ways to show mastery in this area is with a workplace credential. However, a lot of students I've worked with don't have one of those. And so then we talk about a lot of these other systems, like, have you ever applied for unemployment? Have you ever, sometimes my students talk about having gone through medical stuff and needing to navigate the healthcare system. All of those count, but our students need to be able to recognize them in order to come up with something to put in their portfolios. Karen says, I think it is important to consider health situations where a translator may not be available. Great, like at a pharmacy or at home or talking to a school nurse about your child. Oh my gosh, the school nurse, right? Now, if I call one of my kids in sick, the nurse often calls me back to make sure it's not COVID symptoms. And if I think about how challenging those calls would be for non-native English speakers. I am always nervous to encourage low-level ESL students to try it without a translator if they are unsure. I also try to empower them to figure out when they need that extra support as they learn, right? So even, I think, Karen, talking to our students about the fact that they, in many situations, can and should and have a right to ask for an interpreter or a translator is a really important thing for them to know. And I think it's related to this idea of self-advocacy, because a lot of places can provide an interpreter, but maybe you have to request one and know that that's an option for you. So what else can we do to help our students demonstrate self-advocacy? When does this skill come up? Well, we could brainstorm problems that one might face related to healthcare or wellness. We could write a letter or email to address a problem or issue. We could read case studies or example problems like that one in the lesson that I showed you about the Diaz family. And we could reflect on and write about a time when you have had to work to solve a problem. What steps did you take and what was the resolution? So having our students do a little bit of reflection there. So when I tried to think about what would be an activity to practice self-advocacy, I came up with this letter, with writing a letter of complaint, right? And, I understand that nobody wants to be seen as a complainer, especially not when it's so easy to be called a Karen nowadays. But, I do think it's important for our students to know how to put a letter like this together, what to include, how to put their problems down in writing, because the truth is that's how you're going to get results in a lot of situations, right? And it's whether you're, trying to deal with Amazon to maybe get a refund, or whether you're trying to negotiate with your insurance company. Sometimes you really just need to send that, email or letter to try to resolve your issue. So this resource kind of helps to see, what to include in the letter. It gives you some examples. Here's a sample letter. This letter is a little bit more focused on like a product that didn't work or an experience that was unsatisfactory. But I think, going to the doctor and not feeling like you got a satisfactory experience, you could adapt this to work in that situation. So complaining can have a negative connotation. So we want to help our students understand that taking action when one feels as though an experience or product was not as expected is a way to be a self-advocate. And we need to model how to complain in a polite yet assertive way in order to achieve a desired result. So I think, it wouldn't have to necessarily be a full letter. It could be an email. They could practice sending an email to you about something they maybe didn't like at school, or even just a suggestion if it made them more comfortable, a suggestion for an improvement maybe. Could be a way to practice this in class. And then another thing I thought about was, after a lot of visits, we get sent these patient satisfaction surveys, right? So on the left here is an example from my email of a link to a survey I was sent after my son had a doctor's visit this fall. And the questions are, these surveys often ask are things like, based on your complete experience with our medical care facility, how likely are you to recommend us to a friend or colleague? Did you have any issues arranging an appointment? How would you rate the professionalism of our staff? So I think even talking with our students about what is a satisfaction survey, what is the information used for, why might it or might it not, when would it or would it not be worth your time to fill it out? And then maybe helping them think about some of the questions and think about answers to the questions could be a great way to bring some writing into your classroom while also practicing this important skill of navigating systems. So as we wrap up, if you can think of any ways that you have helped your students develop the skill of navigating systems, it would be great for you to put that in the chat. I know that a lot of you do this kind of work with your students all the time. And so I'd love to hear about some of your favorite resources or websites as well. And we have about a minute left. So if you wanted to share in the chat, that would be great. Or if you had any questions, I'm more than happy to answer questions. Yeah, Lisa says completing a Likert scale survey. That would be good practice. Yes, Lisa, you probably know this, but I am pretty sure that on a Google form, a Likert scale is one of the types of questions that you can include in your survey. So you could put one of those together, asking questions about your class, for example, or services in the community or something like that, and give it to your students for practice. I'll tell you guys a really quick kind of funny story. We work in trimesters in my program, and we're about 3/4 of the way through our first fall trimester. So I asked my students in class, how is class going? Tell me from 1 to 5. And most of the students said 5, and one person said 1. And I said, well, that's okay. You can tell me it's a 1, but I would like to know why. And later he sent me a message saying, sorry, I didn't understand, teacher. Your class is good. So now I say 5. And I thought, oh, that's nice. But it made me think, right, that rating system of 1 to 5 is not intuitive or universal. So explaining stuff like that is helpful. And Karen says a lot of health intake forms now need to be filled out ahead of time. Yes. So practicing that common information needed and entering it on a Google form. Great idea. Okay. I want to thank you so much for coming here. I want to wish you a wonderful weekend and enjoy the last part of the conference today. And thanks to Mariah and Amber. Thank you.
Thank you so much, Stephanie. I will now stop the recording.